now. So just to let everybody know that we're recording as well. So we're doing this session and the series a little differently than others have been done. The leadership contest is now truly on, and it's in the last 3 weeks. So we thought we'd give the contestants a chance to really showcase themselves, so to speak, and Courtney is our guinea pig for that. So while we have prepared questions, we're going to give Courtney 10 to 15 minutes to tell us about who she is as leader and how her life experience informs her leadership style. So this is a more unstructured format than we had originally planned. And as I said, Courtney is our test run on this. So thank you very much, Courtney. Also, the recordings should be available on at least NIPR's YouTube page and hopefully SGI's and KCL's as well. So to the main attraction. Courtney, thank you so much for joining us tonight. I know that you have a shift at emergency after this event, so we'll be sure to end on time.
Perfect, thank you. I can see that my internet may not be perfect, so if I start getting patchy, let me know and I'll tether to my cell phone.
Okay.
That is the wonder of the North. So thank you so much for having us, and what a great group you've got gathered there. So I'm in Yellowknives Dene territory. This is Chief Dragi's territory, the traditional home of the Yellowknives Dene. And I've been here for about a decade now. Turns out that my parents actually met here back in the 60s. My mom was a teacher and my dad was a taxi driver at the time. And soon after, they went down to North Vancouver, which is where I grew up. Everybody's looking a bit choppy in the video, so I'm actually just gonna go ahead and tether because I have a feeling this is so give me 2 seconds here.
You're looking pretty stable from our perspective. You're looking pretty stable from our perspective, Courtney. Oh, did we just lose Courtney?
Yeah, she's just gonna switch to her phone internet. It's it's more expensive, but it's faster.
Okay.
I could go on about that. Mine is $250 per month. Somehow reliable, but that's how we get around.
Yeah, so that speaks to, Courtney, just, break in when you're back, but that speaks to how internet should be a human right and how important it is, especially in the age of COVID, that people have access to be able to do their work and learning from home.
Yeah, it's very true. Thanks for having patience through that. It's true, and the rural-urban divide in internet has unfortunately gotten worse during COVID. So whereas I used to be able to use the Wi-Fi for my work activities, I'm tethered probably 50% of the time now, which is expensive. And so it's definitely making it, more, there's more barriers for everybody, which is unfortunate because I think COVID has equally made clear that there's a lot you can do from a remote place, despite the fact that, we're geographically far apart. There's really very little we can't do if we're well connected. So we're talking about that quite a lot on our campaign. So yes, I grew up in North Vancouver. I did a lot of gymnastics and dance growing up and had a mind that was very much at the intersection of arts and sciences. And so applied for multiple different programs, hedged my bets, did, English, journalism, biology, and then finally decided to go into kinesiology and dance at Simon Fraser University. So I graduated with a joint degree after 5 years of course overloads and decided to go into medicine because someone had told me along the way that it was the most artistic science. And unfortunately, along that path, my mom got very sick. So she was diagnosed with non-Hodgkin's lymphoma at the age of 55 and went through intensive treatments for about 4 years and passed away at the end of my first year of medical school. And so that experience really formed my philosophy of care. I feel lucky that the worst thing that ever happened to me in my life allowed me to become better at my profession, I think, and really came at the right moment to really shape my philosophy of care. So I have a very patient-centered philosophy of care, very compassionate and yet very action-oriented. And, you know, it's my privilege to have been able to serve this community up here in the north for almost a decade now. And so we are the most northerly CT scanner in the middle part of this part of the country. And so what that means is if somebody bunks their head up in Nunavik or anywhere in the Arctic Circle, they come down and they see us. And so what that means is that I care for one of the populations in one of the parts of the world that is warming the most rapidly. So I actually did my first reading on climate change as a very new grad. So I ended up training at UBC. I did my family practice at McGill and then, did my family practice in Victoria and then emerge at McGill, and then was going north so that I could prepare to work for Doctors Without Borders by getting experience in a remote location. And I picked up a book on climate change on my way through the Edmonton airport. And what ended up happening was that I went down, and as I'm sure many of you have at some point, a very, very quick, rapid rabbit hole in terms of my learning about climate change. So I essentially had my climate awakening moment in one of the most rapidly warming places in the world. So I would kind of look up from the paper, hoping that maybe things were okay, and then, you know, speak with an Indigenous elder who would say, you know, things look entirely different than when I was born. The permafrost is melting and becoming unstable. So trees are starting to tip over. We have entire forests in the north that we refer to as drunken forests because the trees are all kind of off in one direction. The ice is forming later. They're finding that there's more potential for trauma. So for instance, a couple of weeks ago when I was in Fort Simpson, the Decho Grand Chief was telling me that a local hunter who was very experienced on the land had gone through the ice and died last March. And so that has consequences for physical security, for food security, for mental health, because you can imagine if you grew up somewhere and all of a sudden it looks entirely different, it's very disconcerting. When permafrost is on a slope and it destabilizes, the whole slope comes down and it looks like a landslide. And so when we speak with elders from the high Arctic, they say that, you know, when they were little, there weren't any landslides and now they're everywhere. And so there's a word that's been coined to talk about that feeling of disquiet, and it's solastalgia. So the feeling of being homesick when you're still at home. And so I, as an emerge doc, I'm trained to, you know, take action when I see a problem. And it turned out that that was actually just right after the Lancet had written very, very, what's now an absolutely sort of fundamental paper that stated that climate change is the biggest health threat of the 21st century. So that was 2009. I finished training in 2008. And I was pretty surprised that I'd somehow managed to get through that many years of post-secondary education in health with people not having mentioned the biggest health threat. I was like, how did you miss the biggest one? That is upsetting. And so I was lucky to be heading straight from there down to one of the biggest family medicine conferences in Canada, the Family Medicine Forum. And I was like aghast and awash with this information and talking about it with everybody. And luckily I happened to say something to the right person. And she actually walked me right over. Actually, it was Courtney Howard, who works in Victoria. And she walked me over to the Canadian Association of Physicians for the Environment booth and introduced me to Dr. Warren Bell, who'd been one of the co-founders, along with Dr. Trevor Hancock, who some of you may know from Victoria, who also co-founded the Greens. And so I was really, I think, very lucky to be sort of pulled into what ended up being the exact right organization so quickly after sort of newly becoming aware of this issue. And so I actually ended up on their board quite soon after that and have been working with them ever since. And so I've been the president the last 3 years and have helped them set up a cross-country set of chapter systems. So really, really proud of the BC chapter. That was the first one that we set up. So Larry Barzilai is now the head. Dr. Melissa Lem, you may have seen on the television. She gets quite a lot of media talking about the health benefits of nature. We've done a lot of work around the Trans Mountain Pipeline. Will and I actually did an interview with Dr. Tim Takaro, the toxicologist from SFU, who did a protest in a tree a couple of weeks ago to protest Trans Mountain. So that'll actually, I was going to tweet that out tomorrow, in fact. And we've done a lot of work on fracking in northern BC and Alberta. And so it's really just been, a real journey of learning. And along the way, I've done research on wildfires. I have done a lot of media. I started to move into policy work because I find that the most interesting. I really like doing the literature reviews to figure out what we actually need to do and then looking for a political window where we can get something done. So CAPE has been really fundamental to the coal power phase out in Canada. So Ontario, Quebec, the national coal power phase out commitment that allowed Canada to co-found the Powering Past Coal Alliance. And I was actually honored to speak on behalf of the health professions at the launch of the Powering Past Coal Alliance at the International Climate Change Negotiations. It was Canada's biggest event that year, held in conjunction with the UK. And to just be able to, and in fact, it ended up being an incredible moment because there were members of my patient population at the same table. So I was able to tell some stories a little bit like what I've just shared, while Elder Francois Paulette was around the table, while the Dene National Chief Bill Erasmus was around the table, while Nathan Obed from the Voice of the Inuit was around the table. And that actually, I was recently interviewed for a book when people ask me what was the moment in my life where I felt like I was doing my best job as a doctor. And that was actually the moment that was the story I told, because as a physician, you have a responsibility to advocate for your patient population. And given that my patient population is so highly impacted by climate change, we're really one of the canaries in the coal mine, so to speak. I really felt at that moment that I was using my skills to their maximum. So because I kind of got in on the ground floor in this, I'm on a lot of steering committees. So I'm on the editorial advisory board of the Alliance of Planetary Health. I'm on the steering committee of the Planetary Health Alliance out of Harvard. I have spoken at a lot of big conferences. I'm taking a leave of absence from a role as the World Health Organization Civil Society Working Group, Chair of Advocacy, board member of the Global Climate and Health Alliance, and actually I've been the Canadian Medical Association member, board member from the Northwest Territories for the last couple of years. So that's been incredible because the CMA is actually at this point the biggest NGO in Canada. So it's a $2.6 billion organization. Most well-endowed medical advocacy organization on the planet. I had passed a tremendous number of motions over about 8 years with them to get them to take action on climate change. So we passed a carbon pricing motion. We got them to divest their organizational funds of fossil fuels and set up a fossil fuel-free fund for physicians to invest in, which was at the time one of the first in Canada. Lots of work around curriculum change. I've helped to start an initiative with the International Federation of Medical Students Associations to get curriculum change. So that's been supported by the World Health Organization. So essentially I've done all of these things to mobilize the health professions on climate. And the reason I did that is because there's a lot of evidence that shows that presenting climate change in terms of health is the best way to connect with people about the issue in a way that they really understand what it means for them and their families, and has been shown to be the best way to motivate them to take action on climate change. So when we're talking about wildfires and smoke, it makes a lot more sense to people why they might want to do, change what they do next Tuesday because of that, as opposed to talking about a CO2 level on a graph. And because of that, we've actually, we found it's been easy for us to get media compared to other organizations. So our current executive director used to be the head of the Pembina Institute in Ontario, and he says we get exponentially more media than they ever did, despite the fact that we only have about 10% as much staff.
So
and
Courtney,
so I think that,
sorry.
I think the opportunity for the Green Party here is that we're at a moment of tremendous global instability. And we're in the middle of a planetary health emergency. So the coronavirus crisis started at the intersection of humans and the rest of the natural world, and has now brought the world to its knees. its economy, our health, our entire system. It, therefore, is the biggest proof point we've ever had that we need to take action on climate change, because climate change, if we don't, will lead to a series of other catastrophic health and economic crises. So I joined the leadership race because I know the evidence around that. I've seen how much change we've been able to accomplish at that intersection. And there's also polling data that shows that Canadians haven't actually made that connection yet. So there's the opportunity for the Green Party to be the party that brings that message into the mainstream, and to use that as its main message heading into the next election. And I do believe that that could be a breakthrough moment for the party.
So the question following up on all of that is, why do you want to be the leader of the Green Party, given all these other things you have done and that you are doing? Why is being the leader of the Green Party the thing that speaks to you amongst all your many other skills and passions? Why is being the leader of the Green Party what you want to do right now?
So as I mentioned, I've tried to create change in as many ways as possible. And that's driven by having resuscitated malnourished children and knowing that malnutrition is the biggest health threat. That's driven by the need to protect my patient population and my children. I live on permafrost. This is real. And we are running out of time. And it's been very, very clear during the pandemic that we need our politicians to be the people who respond to evidence and make decisions. We've seen such huge changes and huge disparities in outcome, between Canada, the US, the UK. That's not because the medical advice is different or the epidemiology is different. That's because the politics is different. And so the pandemic has just made so clear that politics is the major determinant of health in society. And so we're at a moment where we need to influence things really, really quickly. And therefore, it makes the most sense to be as close to the decision-making chairs as possible. And the Green Party, given that it really does have a focus on evidence, given that climate has been a huge priority for it, I believe is the one that is the most likely to mount an evidence-based, ethics-driven approach.
Excellent, fantastic. I love your line about we need the politicians to be the one making the change, and that's a decision that I've come to myself, even in terms of where do I give my money. And so for all the people on this call, really thinking about where do we want to put the most of our money, I've kind of come to the same conclusion, and I'm thrilled to hear you say that it's the politicians we have to depend on now. So thank you very much for that, Courtney. At this point, I've enabled the chat, and so people can put questions into the chat now. If you like, you should be able to do that. Hopefully that is, yes, someone already said your approach makes so much sense. So, so while people are putting their questions in the chat, and please everybody just do one question. There are a lot of people on this call, and I know Courtney would like to address as many as she can in the half hour she has left. And so while we're getting questions in the chat, Courtney, can I just ask you, if you become leader, what do you think your first 3 to 6 months will look like, assuming we don't have a snap election called?
Thank you for setting that criteria, because very much two different sets of action arms. So I think, having had a lot of conversations with Greens across the country at this point, it's clear that the party is in a state of transition in more ways than just the leadership race. I think the leadership race has really brought forward a lot of really, really good discussions around diversity and inclusion, and has really signaled the need for culture change within the Green Party, as it has in every organization I'm part of. So I just want to stress that I think that this is societal, but it's also really necessary work. And we've heard from some of our leadership candidates, Amita Kutner, others, Annemie, Paul, that they haven't always felt as safe within the party as they would like to. And so we went through a series of sort of a 3-hour-long workshop as a group of leadership contenders in terms of cultural safety and how do we create safe spaces. And you know, we've done a lot of work around that up here in NWT post Truth and Reconciliation Commission. So, you know, I'm under no illusions that a single session is you know, gonna magically fix everything. But I do think that, you know, a similar initiative throughout the Green Party at the different EDAs is really, really important. We also heard from youth that it wasn't maybe the safest space, and we need to similarly make it really clear, set the norm within the party that, you know, this is a place where we welcome youth, not only so that we can say, look, we have youth, but because we really want to know what they have to say and we want to act on their suggestions. And so number one, I think we need to do some of that internal work. And the reason is that then when we attract people with our awesome policies and our other work, they'll want to stay. They won't kind of come. I keep thinking about this like an actual party that you're throwing in your kitchen. You know, if you've got your old friends in the kitchen and you're inviting your new friends and you bring them in and then nobody talks to them and then they sort of talk over them and they're just going to go like, right? They're going to leave again. So we need to make sure we do that so that when people come, they'll be like, yes, this is a group of people I feel safe, is an incredible community, and we're going to do some great work together. And so a lot of those bones are there, but it's a huge time of societal transition. So we need to do that work. So that's number one. Number two, you know, there's a new executive director, and he will be rearranging the staff federally or in Ottawa. And I've done a lot of work with the executive director at CAPE as well as at other organizations I've worked with. So that's a role that's very familiar to me. You know, I'd want to be spending a lot of time with him to get a sense of how things are going there so that we can prepare the back end for an election in terms of being really organized, in terms of, you know, the platform being ready well ahead of time, the communications being sorted so that the messaging has been determined and message tested in the different ridings, so that, because we know that different messages actually resonate with different populations, different groups of people. And so we need to do some of that work well ahead of time, pick our candidates. Will and I have been running webinars, change-making webinars, and we've been focusing on change-making skills, and we would transition that into campaigning skills. So immediately create a community of practice with things like Nation Builder across the country, so that when the writ is dropped, we're good to go. That's what I would be doing in the next 6 months.
Not too shabby. I think that will probably keep you busy.
Yep.
And Harold Hummel, who is from SGI, has a question from the chat. But Harold, just before we go to you, someone in the chat has asked, Courtney, do you speak French fluently? Can you just rattle off something in French for us?
Oui, alors je m'appelle Dr. Courtney Howard. J'ai grandi à Vancouver-Nord, alors j'ai pris des cours d'immersion de maternelle à l'année 12 et puis j'ai vécu à Montréal pendant une année et aussi à Djibouti pendant 6 mois et j'ai travaillé en français. Alors c'est pas parfait, mais j'ai déjà été vraiment immersée en français et je pense que c'est assez bien pour cette tâche.
Merci beaucoup. Okay, Harold, do you want to unmute yourself and ask the question from the chat?
Right. Okay, so let me find this. Hi, Dr. Courtney.
Hi.
There's a question that says, you received a C on election reform. How important is election reform in your priorities?
You know, it's interesting, all these marking things that get tabulated, because they don't come talk to us most of the time. And so, you know, it's like getting marked on something that you haven't necessarily.
This came from Fair Vote Canada. I actually saw that today. That's why this caught my eye. Yeah.
Yeah, I saw that too. So in fact, when I was putting our platform together, I didn't focus on that because it's already so strong within the party. And so I thought to myself, okay, well, I'm going to not say what's already been said a million times. I'm going to come and say where I think that the party can go. So what we spoke about in terms of electoral reform was more about the need to increase diversity around the table. And I do think that's really, really important. And we were looking for ways to do that. And, you know, just even having now run for this position, it's been really, really clear that it's been easier to do that because of the connections I already have, because of the financial resources my husband, who's a pediatrician, and I already have, because of the education I've got. So it's really, really clear that privilege makes it easier to run for office, and that is going to end up selecting out. It's just going to be easier for certain, you know, more privileged people to get around the table. And as I've mentioned, I've been around decision-making tables enough to know that it really matters. You know, the Canadian Medical Association has climate change and health on its strategic plan now. That would not have happened if I wasn't there. There's only 7 things on that strat plan. $2.6 billion organization, that matters. And so we need to be making sure that we get different people there so that we have less blind spots. At a moment like this in human history, we need a diversity of ideas. We need to make sure that we have just all of the best thoughts, the best life, or a diversity of life journeys, that we're not sort of going off in a blind direction. And so what's worked really well here in NWT has been a campaign school for women. And so they've been running it over the last several years leading up to each of the federal and territorial elections. And our premier, who's currently the only female premier in Canada, and she's Métis, credits that as having been absolutely fundamental to her political success, as well as the political success of most of her cabinet who are women. And so we, Will and I, that was one of the inspirations behind our webinar Change-Making School series, was like, okay, well, how do we sort of start to even the playing field here? And so we've been speaking with some of the people who have been doing the curricula for that, and would bring some of those, you know, the same sort of curricula, as well as, you know, practices. I think some of them would be willing to be on these webinars to help us out, and clearly open that up to a more diverse group of candidates. And so that's something we've thought a lot about. We did choose to emphasize the lowering of the voting age to 16 because intergenerational justice is a big reason why I do this work. I think that, you know, today's teens are going to be impacted by the decisions we make now so tremendously. And, you know, in the emergency department, if I go to work right now and a teen comes in, you know, a 16-year-old, and they have a difference of opinion in terms of what should happen to them for their medical treatment, they win. You know, if their parents are saying, you know, George used to do this, and George is 16 and George wants something, like his autonomy, we give children and teens the respect that allows them a great degree of autonomy in other areas. And I think we ought to do that when it comes to voting as well. And in terms of electoral reform, you know, we know that similarly to having more women around the table, where we see an increased proportion of decisions that are made that are pro-social in terms of promoting health-related expenditures and environmental-related expenditures, we know that proportional representation systems help to also elect more women and help to have a greater degree of consensus, and also more decisions that serve society better. So it is a priority of mine. But yeah, I think of that as being one of, you know, the Green Party's top 3 priorities. So I just didn't talk more about it in my platform. So anyway.
Okay, thank you.
Yeah.
Okay. Thanks, Harold, and thanks for that answer, Courtney. And next we'll go to Helena with a question from the chat. Helena, do you want to unmute yourself?
All right, so one of the questions that I saw said, hi, Courtney, you have such an important job as an emergency physician in the North. I assume as a leader, you will have to leave this position. Is the work you do vital to the population there?
So I have, as a result of this other work that I've been doing, working about half-time since my children went back to school. And the bottom line is, and I thought about this a lot, that if I leave this position, somebody else will take my place. And that has happened. I am filling in overnight tonight, but this is sort of a, you know, there's been a gap in between 2 locums, and the regular docs couldn't fill it, and it wasn't worth flying someone up for 1 shift. So I'm filling in. But really, right now, the greatest emergency is outside of the emergency departments in Canada. And I think I can have a bigger impact outside. So that's why I've made this decision. But it's not easy. I love emergency medicine. It takes a long time to get good at it, and I'm finally good at it. And so it's it's something I think about. I will try to work a couple of shifts a month if I can. But yeah, I know that other physicians are less likely to take my place outside of the hospital. So that's where I'm going.
And having a good leader for the Green Party, I think, is you will serve many more people than, what I'm going to say sounds terrible, than serving the people in the emergency department. Oh, that's a terrible thing to say. Forget I said that.
Well, there's seasons in life, and so I've done that for a significant season of my life, and I think this is the season to switch my focus. And the one thing I love about Emerge, and one of the reasons I went into it actually, I think had to do with the fact that 9/11 happened in about my second week of medical school. So it really made clear that the world can change fast. So I wanted to do a job that would be useful no matter what happened, no matter what resources I had at hand. And I have worked in a lot of, I've worked everywhere from the biggest trauma center in the United States, where people get a CT scan. If they practically walk in through the door, they just got run for the CT head to toe, to tiny nursing stations and a slum in Africa. And so I know that no matter what happens, I'll be able to go back and be useful clinically at a later date. And I'll do that then. But this is the time we really, really need to push to make sure that this is a healthy recovery.
Right. And part of a healthy recovery, of course, is all kinds of security on many different levels. So what would you suggest the federal government in Canada should be doing to promote food security, agricultural land reserves, and facilitating young people's participation in farming in terms of addressing those issues?
Thank you. I love that question. We've been thinking about that a lot. So I've done a lot of reading about it, and if people are interested, one of our webinars, we had Darren Quamby, who he was the author of a report on fixing the climate crisis and the farm crisis at the same time for the National Farmers Union. And it's fascinating. And the bottom line is that we have a corporation problem there. Similarly to the corporation problem that we have in the fossil fuel industry and in medicine or pharma, I hadn't realized that was such really the place that we need to focus our efforts. So at this moment in Canada, for every $100 that farmers earn, 95 of those dollars go to corporations. And what's fascinating to me as a doc is that a lot of these corporations are an arm of a pharmaceutical company, and they use the same playbook in both spaces. So these things that they try to do in medicine, they try to teach the medical students right off the bat, so we get brainwashed into using really expensive medications, brand name medications, instead of older generic ones that are much cheaper that work just as well. They do that with the farmers too. And I think that what seems to have happened is that maybe because docs are a little bit more, I think there may be a little more public scrutiny, but they've actually managed to infiltrate agriculture schools, basically the continuing education of farmers. Canada has sold off a lot of our test plots. So we used to have a lot more sort of national farm plots where we would test out what seeds worked in different conditions. And these seeds would have been essentially created or bred in national laboratories by public scientists. And so the problem with having moved from essentially a public research and education system for farms to this immensely privatized one is that now these poor farmers, and I actually own a farm in Manitoba. It's part of the family farm that's been in our family since 1885 when my grandma died a few years ago. Because I believe food security is really important, instead of receiving the inheritance, I asked to receive part of the farm. And so I've been transitioning it to organic with the help of a local family who farms organically. It's been really clear that we need to bring a lot of those practices back into the public space. So we need to invest in public research into climate resilient crops so that we know what works. So we can just, as things change, we can be very agile in terms of, you know, helping farmers know what to grow most productively where they are. We need to invest in thousands more agricultural extension workers to help do that education with farmers. We need to invest in a national system for data, because one of the other places where the farmers are getting just channeled into this private system is with regards to data. So there's advantages in terms of saving on fertilizer as well as pesticides if the data gets uploaded into kind of a big data type of repository. And I've been in combines where this is happening, and in fact a lot of combines are now actually GPS controlled. So the farmers, in an effort to really exactly lay down the spray, can actually just turn off the controls, and the tractor will drive itself so that there's no overlap and there's no gaps. So it's a really efficient way of doing things. But what that means is all that data actually can get uploaded into these company servers. And so you can imagine that then further locks the farmer into that brand name way of doing things. And so what ends up happening is that then they sell the crop, but their inputs have been so high, and so you know, a lot of the seeds can't be used again. So it's not like they can just reserve some of them. You know, they're sort of made to self-destruct, so they have to buy new seeds every single year. It means that the farmers are having to work two jobs. So they're having to work off the farm, you know, as an accountant. Farmers I know are accountants, doctors, working at banks, these kinds of things, in order to be able to make ends meet. So they're working night and day. Eventually they get exhausted. They sell the farm, and if the farm, most of the time, is bought up by a giant conglomerate that then sticks it in just high input in terms of greenhouse gas, in terms of nitrogen fertilizers, which is basically oil, because it's made in a very oil intensive way, as well as high other fossil fuel inputs, sort of aiming for an export market. And none of that is what we need. You know, we need locally produced food that is made in a reasonable way that creates a circular economy locally, that's made to meet the nutritional needs of that population in a resilient way as we move forward into a more unpredictable climate. And so so what we need is all these the public services and systems that I was speaking of. We've had a lot of questions around cows, and we asked Darren that, and he says that we probably need about 15 to 20% less cows in Canada. Feedlots are the place where really that are really problematic, because, you know, they're eating corn or, you know, another crop. They're not ranging, they're not providing a service in terms of sequestration. There's a lot of diseases that can break out there. We end up using a lot of antibiotics. It's not ethical practice many times. However, when we think about what is the most sustainable circular economy for a farm, for instance, my farmer, he did spread manure on my field last year. And so what we need to likely be working towards is less cows, better lives for the cows, and making sure that we're using all of what they produce in a sort of closed system kind of way as fertilizer for our farms. And so, you know, my question going into all of this was, should we have a carbon tax on methane, or should we add methane from cows to the Pollution Pricing Act? And after all of this, I would say no. Because really right now, I think our huge priority needs to be keeping these farmers who are currently on the farms, because the minute that land is lost to us, we're not going to get it back. And so they're tenuous, they're super tenuous in terms of their, in terms of the money that they have in order to keep them there. And so I think we need to really focus on aligning our subsidies with the Canada Food Guide, which has the most sensible approach. It's an incredible policy We're super lucky that Jane Philpott put up her arms and said no to industry input and said, no, food and beverage industry, you are not allowed to participate in this process because we see that as a conflict of interest. So we've got a food guide. Let's make sure our farming practices align with our food guide, which is, you know, very plant rich, but still allows for some animals. Because I think that that will actually end up with us being able to create a circular economy in agriculture that will allow us to grow the local food that we actually want to eat.
Right. Yes, there's a lot there, that's for sure.
Yeah.
And amazingly, I was shocked to discover that my compost actually needs animal manure in it. When I learned that last year, it was like, oh, really? So yes, we do need that animal poop.
I didn't know that actually.
Oh, yes. Just composting your vegetables is not sufficient. You actually need the nitrogen from the manure. So.
Well, I was going to ask how you did that, but I won't.
Okay, so Harold has another question from the chat. Go ahead, Harold.
Yes, there's an interesting question from somebody who said, if leader, what would be your main strategies for funding a just recovery or / Green New Deal?
So I think there's two approaches to this, or two elements to this approach. Number one, we have an inequality problem in Canada. So our wealthiest are getting wealthier, and with COVID, we know that so many people have lost their jobs and there's so much instability. And so like many of the other leadership candidates, I'm very much in favor of a guaranteed basic income. And I think that more and more people are. The Canadian Medical Association's talking about it more. You know, we're hearing from the NDP and other parties. And so I think that we need to keep pushing that, because I think current measures still leave a lot of people slipping through the cracks. And when you look at the fact that inequality is really, really toxic for society, so in different countries with higher measures of inequality, we see worsened mental and physical health, we see poorer status of women, we see children's health also being impacted, we see higher measures of criminality. So, and it's not even good for rich people. When you look at what's happening in the US, with COVID, their levels of inequality and the fact that poorer people haven't been able to access healthcare has actually increased risks for richer people, because there haven't been enough tests and the virus has completely gone out of control. And so we can safely try to decrease some of the extreme wealth and know that that will be good for our society. And so a tax on the top a net wealth tax on the top 1% should yield about $10 to $20 billion. If we go looking for the offshored corporate profits, depending on, you know, there's a very big range in the parliamentary budget officers estimate on that, but it was around $20 to $40 billion. It's quite a lot. Those can help us pay for things like a guaranteed basic income. We also think that it's really important to increase some of the care provided. So we've had this Canada Health Act. We would propose a Canada Community Care Act that includes universal public daycare, which should pay for itself. Studies on the Quebec model have shown that. We would also include in there pharmacare, psychological care, because we can anticipate that mental health challenges are already higher and will continue to be high through the pandemic. And we would also put dental care in there. I see probably some of the very, very most miserable people I ever see in the Emerge at 2 in the morning are the people with a dental infection that got out of control. And by the time they come see me in the Emerge, which is covered for everybody, you know, they've got a tooth this big and it's spreading, this swelling spreading down their neck, and I talk to her like this, and then we have to start them on IV antibiotics and drain an abscess, and it's life threatening. And like, it never had to get that bad. And so we would include that as well. So those are some of the main measures that we would use to support people now.
Thanks very much.
I think the question was looking more to be, what would be your main strategies for funding it? So I think you mentioned one, okay, of the tax on the wealth. I wonder if there was just anything else that you were thinking of, just to be fair in terms of giving an answer.
Yeah, fair enough. So the tax on the wealth, the corporate tax, we proposed a financial services tax as well. A tax on sugar sweetened beverages to help subsidize fruits and vegetables is also on our platform. And then, you know, we need to recognize that high income countries around the world who have debt, the ability to issue debt in their own currency, are borrowing a lot. So when we went into this crisis, our debt to GDP ratio was about 30%. When I graduated from high school, it was about 60%. So in living memory, it was twice as bad or twice as big. So we had some room to move. We're now about halfway through that, but because interest rates are so low, we should still be able to service that. In fact, when Morneau issued his financial update in July, he said that our borrowing costs at that moment, despite the fact that we just borrowed a whole bunch more money, were actually lower than they'd been 6 months earlier because interest rates are so low. And so quantitative easing is our friend right now. There are people who really are fans of the modern monetary theory. And the thing is that with interest rates so low, it's, you know, it becomes close to being almost a similar way of moving forward. And so I think we could count ourselves very, very lucky that we have a central bank structure the way it is, and that interest rates are at this historical low.
Okay, thank you.
Mm-hmm. Thanks, Dr. Howard, and thanks, Harold, for persisting with that.
Yeah,
great.
Thanks.
So we have about 5 minutes left. I think maybe we can get in one more question if you're willing to have another one, Dr. Howard.
Sure, yeah, absolutely.
Okay, Helena, why don't you go ahead?
All right, another one from the chat was, how do we help the media better tell the evidence-based story on climate action, the climate crisis, and planetary health? There was also a little comment at the end that said it's very disappointing that the GPC leadership race has not received more attention given the remarkable quality and diversity of the candidates.
Yeah, it's true. And I think that actually has to do somewhat with us not having made this connection with health, because we know, like, prior to the last election, as a CMA board member, we did we did polling, and we saw that health was a top priority and climate was a top priority, almost on a par, but people had not realized that they were the same thing. So imagine if we're able to be the people who make that connection for people. I've spent a lot of time trying to help docs communicate better. So I run advocacy workshops around that. And I've been really, really interested in how do we do this? One thing that we know we need to do is tell stories as much as we use data. So we know that numbers numb and stories stick. So that's something that we brought into our change-making school. And that's something I always talk about with doctor advocates. So what is the moment? Can you describe the moment where you decided to take climate action really seriously? And most docs will talk about a wildfire event, seeing, you know, a lot of asthma patients, or a heat emergency when many older people were dying. So we need to incorporate not only the best evidence along the lines of the basic science, but also the base evidence, the evidence in communications. And actually, if you're interested, join our webinar tomorrow, because we have one of the world's top communications scholars, Ed Maybach, joining us. Yeah, he's like, he just won one of the the US's biggest science communications awards about 2 weeks ago. So you'll love him. He's incredible. And I think we also need to get better at using audiovisual mechanisms. So I know from working in nonprofits that we usually don't have much in the way of a budget, and we'll produce these giant, you know, evidence-based reports with a gajillion references, and no one really has time to read that. And so that's actually one reason why when we put our platform together, we have so many different levels of depth and different ways of reading it. So you can, you know, and Will, who's there, I need to give incredible credit to Will. He's an engineer, but he has an incredible eye, and over the course of this campaign has taught himself how to edit video as well as do all this incredible graphic design. So we've had comments on our platform that it should be submitted for design awards, because, and actually we've also had academics from around the world, like Brazil, South Africa, different places in the US, the UK, say that is an incredible way of communicating this information. And so we tried really hard to have videos, to have images, to have a little bit, to have way more if you wanted to see it. to be coming in. So we need to be working with artists. We need to be working with people with different skill sets, to be humble where our skill sets end and where somebody else's start, and to really reach out for those skill sets.
Fantastic. Thank you so much. It is, by my clock, right on the top of the hour. So Dr. Howard, if you want to leave and get ready for emergency, we release you. We really appreciate you coming and joining us today and sharing your vision, and you have contributed an awful lot to this leadership contest, and I'm very grateful that you're part of it. So thank you.
Thanks so much. And you know, I really, really appreciate the work that everybody at the EDAs puts in to keeping these fires burning between elections. This is incredibly important community building. You know, thank you. We ran into so many people who are isolated with their worries, and I've done a lot of work on eco-anxiety. We know that action feels better than anxiety. And so by convening this, you're giving people an opportunity to put their sense of the world needing to change in a really positive, action-oriented, focused way. And so thank you for doing that, for providing us with this opportunity. And I'm really looking forward to working with you in the weeks and months and years to come.
Fantastic. Thank you so much. So for everybody else on the call, as we mentioned initially, Dr. Howard has to go for a shift at the emergency department. So, so she's free to stay if she wants to, but she probably would like to get ready for work. And I also, thanks, Dr. Howard. I just want to say a couple of words to people about the ballot and about voting. And quite a few people have said they're not, you know, they think it's fine if they just do their first choice or their first two choices or their first three choices. But we use a ranked ballot. And so it's really important that you rank as many of your choices as you feel comfortable doing. Because listing all your choices in the order of your preference means that your voice counts in all stages of the vote count. So if you only rank 2 or 3 people, then you don't have a voice in any of the rounds of counting the ballot after your 2 or 3 people are eliminated, if they are eliminated. So ranking more than just 2 or 3 means that your voice is counted at every stage as the votes are counted. But also, Anita Nickerson from Fair Vote Canada said, the advantage of ranking all of your choices, all of the contestants, is that no matter who wins, the ranking provides valuable information to the new leader and the party membership about what the members value beyond just their first choice preferences. And it gives the leader an idea of what kind of support there is out there for certain messages and approaches when they reach out to different camps after the election and start the process of uniting the party. So it is important that we rank as many people as we are, I guess, feel comfortable with assigning a value to. But just know that your voice doesn't count if you haven't ranked someone. So I just want to say that. And I also want to say for people who are leaving that the next event in this series is going to be with Dimitri Lascaris. It's going to be on Saturday, September 5th at 6:30 p.m. Pacific. And it will be hosted by Mark De Bruin from the NIPR EDA as well. And so officially we're at an end, but if people want to stay, you're welcome to stay. And sorry?
Unmute everybody?
No, don't unmute everybody. No, we don't want to unmute everybody, at least not yet, unless everybody promises to behave themselves. But we would like to open it to the floor. And if people want to stay for a conversation, William Gagnon is still on the call with us. As he said earlier, he's Courtney Howard's campaign manager. And he would like to play a very brief video. I'd have to allow you to share the screen, William.
I think I can do that on my end.
Oh, as the co-host? Okay.
Yes.
So
Well,
if we play that screen briefly, and then maybe we will unmute people or allow you to unmute yourself, and then we can have a conversation. So go ahead, William.
Thank you so much, Megan, for organizing this. And I just want to show people two things very quickly. The first is our video for the change-making series that we're organizing. That's not it. My email. I just feel like I'm a beginner in this Google Chrome here. So these are our Thursday change-making sessions. They last about an hour and a half, and we bring guests every week. So I'll just show you this one here, 46.
Action feels better than anxiety. I don't worry anymore. I just do the work.
That's the teaser. So in next week we're seeing these three amazing people. So it's really rare that you get Kat Abreu, Ed Maybach, and Diane Sachs in the same room. They know a lot. Especially, I love Ed Maybach because he knows how to communicate climate change, which I think is something that we don't really talk about. Kat Abreu is like a superstar in Canada on climate action, and Diane Sachs was the Ontario Environment Commissioner. She is a power force, so I really hope that you guys can join us, and I'll stick around if you have any questions. Thanks again, Megan, for hosting this. Oh, you muted.
Yeah, was that one of the things you put together? Because that's pretty slick.
Yeah, so I learned so much on video making. I did not learn that in school, and if anybody wants to learn these skills, I would save you the 12 hours I spent on YouTube, and I'm happy to take 20 minutes with you and show you how it works.
Wow, 20 minutes, fantastic. Okay, so people can unmute themselves if they want to ask a question. You can also raise your hand, your virtual hand rather than your physical hand, if you have a question, and you can raise your hand by going to the participants list. So you click on participants at the bottom of your Zoom screen. That opens up the whole list of participants, and at the bottom of that there should be a raise hand option. I can't see it because I'm the host, and I don't get to raise my hand.
Oh, that's why I never see it. Okay.
That's why you never see it, William. So if anyone wants to raise your digital hand, I should see that in the participants list. Otherwise, you can unmute yourself and just pose a question if you have a question for William, or if you'd just like to start a conversation.
I'd like to start a conversation. This is Sheena.
Okay, Sheena, welcome. Go ahead.
Thank you. Wonderful discussion as usual. I'm just going to pick up on with one comment, which is that it's up to the politicians, which I don't agree with. I think that individuals are as powerful as politicians. And since so many of us act in so much more ethical a way than many politicians, we really do have as much power. And we have the power because if we don't buy it, it won't be made. I haven't bought tinfoil or plastic wrap for at least 20 years. No, I was 30 years. I don't buy it. I don't use it. I don't use anything made of plastic. I hardly buy anything in tins. So we really have enormous power. We just need to stop buying it. And yes, the economy is going to tank. And frankly, the only way to save the planet is for a lot of people are going to lose their jobs. That's just the truth. And we need to massively reduce the Earth's population. which, you know, diseases are going to do it for us if we don't take action and do it. But we do have to take personal action, and guaranteed livable income will be extremely important because so many people are going to lose jobs, and we have to, you know, wipe out the oil and gas industry and that sort of thing. And not everybody can be retrained. There won't be jobs for them to retrain. And we have to do that. And we should call it guaranteed livable income. If we say basic, that's exactly what people will do. They will do basic, which won't even pay for it. But we need to be careful about that. Right.
So thanks for that, Sheena. You're absolutely right about personal responsibility being a major factor here. I don't want to speak for Dr. Howard, but I would say, I guess, my own personal view is both are essential, but without political leadership at the top, nothing is going to happen, no matter how many individuals. You're right, if we don't buy it, they won't keep making it. But it seems we've been so brainwashed since the 1950s that we have to consume and we have to buy and we have to keep buying more and more things. And that's a mindset that's very hard to get out of. Do other people have thoughts on this? I cannot believe 26 screens don't have thoughts on this.
I find that people are just shy. So why don't, okay, Mark.
I can't see how to raise my hand other than raise my hand.
Okay.
Yeah, just a thought. Not to negate or criticize what was her name, Sheena, that just spoke?
Sheena, yes.
Sheena? Yeah, what she had to say. But gosh, Sheena, after not buying tinfoil and saran wrap for 30 years, we still sell a hell of a lot of it in our society, and it's a bigger problem than it's ever been. So, you know, to the other side of that argument, one way to phase out products like that is if government made decisions regarding that, and we could massively motivate and mobilize a whole society through political action. It's true that individuals have a huge, huge role, but as Megan has already said, without political leadership, it is so glacial in the way, at the rate that it moves, and we don't have time for that. So I see the two interweaving very, very critically. We must have politicians that have the courage to make the decisions to mobilize massive change. We'll never get to a green economy if we wait for individuals to do it. There are some of us who want to do it, who are already doing it, but we need to do it as a society, and that takes that leadership.
Mrs. Heavens has her hand up.
Yeah, I didn't mean to imply that we don't need politicians to do.
Breaking up.
Yeah, you just froze, Sheena. Sorry. Maybe if you turn off your video, Sheena, then your audio might be a little more stable.
Megan,
yes.
Glenn had a question. She had her hand up.
Okay, go ahead, Glenn.
Yeah, it's not so much a question as a comment. I too believe that we need both leadership, but where I find the difficulty is that in addition to things like carbon pricing and guaranteed livable income and taxes on the rich and inheritance taxes, we also need regulation, and we need to favor, for example, certain types of foods over others and certain and various products. And the catch-22 in that is that not only do we have to divorce the politicians from their usual industrial lobbyists and promises of kickbacks now and jobs for the boys later, but we have to get it to a point where people are prepared in huge numbers to forgo the plastic wrap and the aluminum. And so we have to work on both fronts. And I'm not sure that we have time, given that we have, we are told that it's too late to stop the Greenland glaciers from melting now. The time frame is something else, but I can see the need to retreat to higher land, perhaps considerably higher land, if the Antarctic is also precipitated. And that is going to mean, while we still try to lower the population, an incredible amount of infrastructure building. And we need the forests and cement. Even the newest forms of cement produce huge amount of greenhouse gases. So it's going to be very difficult. And I would love to hear somebody who has more ideas than I do as to how to deal with this as best we can. Thank you.
Yes, thanks for that, Glenn. Terry, go ahead.
Okay, as you can tell, I'm a senior citizen on a very limited income, but I did not hear her once talk about healthcare and the prescription costs, because I know many of the drugs I need to take, I do not have a choice. They're required for my diabetes and stuff like that. I'm paying, like, for 4 pills, $25. And I think if we bought them as a Canadian government, that they'd be a lot cheaper than buying them, you know, individually each province.
Yes, absolutely. And I think National Pharmacare has been a Green Party platform for the last 15 years or something like that. William, did you want to respond? Sorry.
Yeah, I would just like to point Mrs. Nicholson to our platform plank number 8, where Dr. Howard talks about pharmacare. It's one of our priorities because we would save a lot of money with that. And obviously, a lot of people would be better off. So I just put the link in the chat. Or if you go to our website, it's platform plank number 8. It's in there.
Yeah.
She is just like, is that a word in English? Adamant? Sorry.
Yes.
My first language. She's just like, I've seen her being really mad at this. So for sure. I mean, it's hard to cover everything in an hour, especially when she just woke up in preparation for a shift. But yeah, for sure. Pharmacare is in there. It's one of our priorities.
Because I live in one of the lowest incomes in all across Canada. I live in East Van. And they keep cutting all services away.
Right. Yes. Yeah, it is a major issue. Thanks for raising that, Terry. Anyone else? We're down to 15 people and we've been here an hour and 20 minutes. Should we make it a wrap or do we want to keep going? We could talk about infrastructure because that is something that is talked about a lot these days, and a lot of the infrastructure jobs are primarily male-dominated jobs. Construction, engineering, the trades, and yet it is women who have been disproportionately affected by COVID-19, and there isn't a focus on getting women back to work. Do people have thoughts on how big a priority that should be, and why aren't we hearing more about childcare? So,
have you seen her? I have a video on childcare I'd love to show.
Okay, do people want to see William's video on childcare, or do other people want to talk about this?
Oh, that'd be great.
How long is it?
It's a minute and a half, I think.
Oh, we can handle that.
Sure,
Okay.
go for it.
Let me just find it. So Courtney is, I mean, we've done a lot of these meet and greets, right? We've done, I don't know, like maybe 60, maybe 100 so far. I'm not too sure. And her kids just went back to school this week. And so many of these Zoom meetings were bombed by, you know, Dr. Howard's kids. And so I came up with this little, let me pull it up. I came up with this little like montage of all the times that Vivi or Elodie jumped in the screen and just completely derailed the Zoom meeting. And it was so funny to put together. Let me, where is it? Here.
The decrease air pollution, make people more active, and support mental health in the meantime. Okay, little sweetie, no. I became quite worried about partway through COVID that we were going to see climate take a back seat, really. I have a small child here coming. Hello, we're in the middle of the podcast. You're supposed to stay downstairs.
Your mic keeps getting muted there.
Yeah, that's me, because there's a 6 and 8-year-old stomping around, getting mad at one another for not doing the dishes.
Oh,
I'm
hungry.
Okay, that's go. There's a lot of foods that she can eat. There's a peach, sweetie. How about you go for that? That's really good. Or some more cheese bread. We make some sourdough cheese bread and actually show the best and most cost-effective and best ways for health to get there. I have a small human here who has a question. I'm sorry. Yes? My husband's a pediatrician, and he's like been on call at the hospital basically continuously for the last couple of months.
Wow. Let's work together. Come on, we got to work together. It's a pandemic.
She forgot her question. You're starting to probably get a sense of why I'm such an advocate for universal public childcare.
Great. These were so funny.
Oh, that's wonderful.
Anyway, that's what I feel like, at the end of a movie, when there's nothing left to show, and then you have like the interviews with the actors, I feel like we're at this point. So I think we cut it short. But I've pasted my email in the chat, and Dr. Howard has basically lost control of her inbox 2 years ago. And last time I checked, she was at like something like 15,000 unread emails. So I just, as a thought, it's easier to get in touch with me. Everything is online on the website, so please feel free. Thanks very much for hosting.
Okay, that's great, William. Thanks for joining us.
Yeah, and thanks for all you do for Courtney.
Yes.
She's so fun to work with.
Yeah.
You can tell.
I go over to her place like once a week to have like a longer debrief from like 6 p.m. to I leave at usually midnight. And Darcy, clearly he spent 15 years in the university, and he's always cooking or doing the dishes for her. And it's just like the salmon we have is just like amazing food. Courtney and I just kind of go work through a bottle of wine and work through all the things that happen during the week. And she's just so amazing to work with because she sees so many bad stuff in the ER. She's like, is this really an emergency? I just saw a guy who came in the ER with a knife in his stomach. And, so it just puts everything into perspective. And whenever somebody is stressed, she just cracks up a joke and then it's like, oh, okay, we'll just do our best work now.
Wow. William, you
Carol,
and Courtney.
Carol, you've got
you and
major
Courtney
feedback.
are the human face of politics.
Well,
That's right.
a lot of
Thank you.
people are asking, are saying oh, Courtney, you're great, but you've never, you were never involved in the Green Party before. And Courtney's reply is usually well, I was busy with medical politics, basically like the CMA or the Canadian Association of Physicians for the Environment. And when we spoke with Elizabeth May at the beginning of this, Courtney wasn't sure if she was going to run because she was like, well, people don't know me and green politics. And Elizabeth May said, well, before, prior to jumping in the leadership race herself, she was super involved with Sierra Club as an executive director, and she couldn't be involved in politics at all because of her position. So she's kind of the same position as Elizabeth May was. And I think that gave her a lot of confidence to run. And she's such a bad politician when you think about this. So usually what politicians do is they spend their time on the phone talking to people, trying to convince them to work for them, to donate money or to vote for them. And as the campaign manager and all the folks we're working with, they're like, Courtney, you have to get on the phone. You have to get on the phone. And she hasn't done it at all. I'm just going crazy. And so considering the fact that we jumped late in the race, the last one in the race, and we fundraised, I think now by today is probably $85,000, maybe $90,000. And hasn't made a single phone call. I'm like, that's pretty good, and she managed to and she's still like doing some work for the WHO Civil Society Working Group. And I mean, 2 daughters. So it's just so much fun to work for her. And she's like, Will, we have to pay you. And I'm like, well, I'm happy using this money to pay other people to help us because it's so fun to be with her. So
Beautiful.
That's
Great.
lovely. Thank you.
Yeah.
And if she does win, just remember to keep October 24th on the calendar because NIPR is having our AGM. So
yes, thank you. So there's so many universities. York University wants a guest lecturer in October, and I'm like, I don't know what's happening in October, guys. Just hold the date. I have it here. So,
yes. Okay.
Great.
All right. Thank you, William.
Thank you very much, everybody.
And yes,
Great.
thanks everybody for joining us. And so don't forget, Dimitri's event is the next event on Saturday. All right. Thanks, everybody.
Thanks,
Take care. Have a
Megan.
good night.
Megan?
Yeah.
Bye.
Bye.
Bye.